Are a DIEP flap and tummy tuck the same thing? Hi everyone, I'm Santina. I am a board certified physician assistant, and today we are going to discuss if a DIEP flap and a tummy tuck are the same thing. I get this question a lot from patients, and so I'm here to clarify a few things for you, so you're definitely not alone if you've been asking the same question. So they do both involve the lower belly, and they definitely both leave you with a flatter looking stomach, but they are actually two very different surgeries. So firstly, for a tummy tuck, this is a cosmetic elective procedure. And so for the tummy tuck, we take out all of this skin and fat here. We do a diastasis repair, so we tighten your muscles as well. A diastasis is when your rectus muscles separate either through rapid weight gain or pregnancy. So we repair that for you as well in a tummy tuck and then leave you with a flatter stomach, all in that process. Now, in a tummy tuck cosmetically, we can do liposuction of kind of the love handle, flank, back area to give you that nice kind of symmetric contour, that hourglass that a lot of women are looking for. In a DIEP flap, this is not an elective surgery. So a DIEP flap is typically used for breast reconstruction. So if a patient is getting a mastectomy, meaning they're having their breasts removed, a reconstructive option for some patients is a DIEP flap. And so what that entails, it is the same, lower belly incision, but there is a lot more work that goes into a DIEP flap. So including microsurgery. So what we'll have to do in the lower belly is dissect out meticulously your vessels through there to be able to hook them up to vessels in the chest. That is the only way that your tummy tissue will have blood flow in order to continue to flow and not have this flap die. That flap needs some blood flow to live. So that is the DIEP flap when we take it on your belly and put it to your breasts. We hook it up with microsurgery, and within a couple days, you'll know if it's survived, if it's working, and all of that stuff. So for a DIEP flap, I will say it takes a lot of patience. It takes an emotional toll on patients because this isn't elective. It's not something that a lot of patients have a choice in with breast cancer. So this can definitely be super overwhelming for patients, super emotional for patients. And also too, in a DIEP flap, the priority of surgery number one, when we're dissecting this belly and making breast out of it, the priority is to keep that DIEP flap alive in that surgery. And so liposuction, contouring, all of that stuff has to come at a later date because the surgery itself does take a long time, and the number one priority is to make sure that that flap lives. So in about 6 months, you can definitely get liposuction of those love handles, the belly, and give you that contour. But within that 6-month stage, a lot of patients do sometimes struggle with the kind of aesthetic of it. It's an emotional roller coaster. It's where the body doesn't really recognize, it can't match up with the mind. So the mind doesn't recognize its own body in the mirror and all of that. So that kind of gives just a basic rundown of why they are very different procedures. And a DIEP flap is not a free tummy tuck. So I hope this helps, and drop any comments below if you have any other questions. Thank you.